Hello, my name is James Grellier. I'm a research fellow at the European Centre for Environment and Human Health, which is part of the University of Exeter Medical School. And today I would like to talk to you about the positive effects that urban water bodies can have on health and well-being, and will present the Blue Health project to you, the motivations behind it, the methods and tools that we've developed in it, with the aim of shaping our cities so as to benefit human health and well-being. Health is not produced by hospitals and the health system, so said Richard Smith, and arguably beyond genetics, human health is largely a product of where and how societies live. In an increasingly urbanised world, health is increasingly linked to the decisions that we make related to the building, development and maintenance of our cities and the infrastructure that support them. The question is whether we choose to make health central to those decision-making processes. Now, I think few would contest the idea that green space in cities is good for health. Cities, green spaces typically being parks, street trees and so on, and a relatively large amount of work has been done on this subject. We know, for example, that from good quality evidence in a number of fields and using different study designs, we can see that more frequent exposure to green space has a positive influence on physical and mental health and on quality of life. We know roughly the pathways through which this works, so direct kind of pathways where people actively seek out to visit green spaces, and those indirect pathways whereby people perhaps have views of green space and so on and experience that in terms of attention restoration, so a bit of kind of relaxation and restoration of their cognitive resources, which are diminished through stresses of everyday life. And we know that green space in cities reduces inequalities in health and well-being where those green spaces are accessible to all. What about blue spaces? Do these have any kind of different effect to green spaces? Well, so we defined blue spaces as any outdoor environments, natural or man-made, that prominently feature water and are accessible to people, to humans. There's a common sense understanding of the benefit of blue health in many cultures, but little robust evidence was available when we started this project, and we were interested to see whether the mechanisms were the same as for green space or different, and to what kind of extent the effects on people's health were larger or smaller and so forth. Now, historically, unlike green spaces, blue spaces in cities have typically been viewed solely in terms of the hazards and risks that they pose to health, and often with good reason. So natural hazards, pollution through through anthropogenic activity, other kinds of activities that people would do that compete with traditional uses of spaces on the coast or rivers and lakes, and also the change which has come in many places due to, for example, tourism, the way that this differentially affects people in different socio-economic and cultural statuses. And all of these things can impinge on health, right from, very important health impacts like drowning and infectious disease, down to the kind of long-term health problems and so on, which might be related to exposure to some chemicals or through stress, the effects on mental health and so on. And many of these hazards and risks are amplified by climate change and its mitigation and adaptation. So we saw that there was a need to kind of look into the benefits of blue spaces and not only the risks. And we thought, well, cities globally are situated on water, and in Europe we've got the perfect test bed to look at some of this, because the European coastline is nearly 100,000 kilometres long, nearly 200 true coastal cities there. More than half of the EU population lives within 50 kilometres of the sea and very close to other kinds of water and other blue infrastructure. And so we designed a project really around a conceptual model. So we knew that we want to maximise our population health and well-being. Now, how do we maximise that? Well, we know from other kind of natural environment exposure that contact is important, whether those are indirect or direct interactions with the environment, and also the activities that people do there are important, the physical activities, the social activities, and even those virtual activities. People watching, for example, nature documentaries or or playing on using virtual reality environments. And also, we're interested in the quality and quantity of blue space, because this clearly has an effect on our contact and our activities. This is in turn determined by the urban planning and infrastructure, and this may all be affected by climate and extreme events. So although here we clearly have urban planning and infrastructure as a kind of node in this diagram, design, planning, infrastructure, landscape design, and so on, all of these things actually relate quite strongly to many parts of this diagram. And so in order to kind of understand better what's happening in here, we needed to do a lot of different kinds of research and to develop tools and methods to understand the relationship between between blue spaces and health, and also to develop these tools and methods so that other people can carry this work forwards. So 5 years later, after a lot of different work, we can say that people living near blue spaces are happier and healthier, both physically and mentally, with the caveat that this is all research conducted in the global north. The hypothesized mechanisms for blue spaces' positive impacts on health and well-being are mitigation, so urban heat, reduction of heat stress, for example, reduction of urban noise or reduction of the unpleasantness of urban noise. Instauration, so the kind of things that we do there, the capacity building activities like physical activity or having positive social interactions with people, connecting with nature. And restoration, so I mentioned before how our cognitive resources can be recharged and restored in certain kinds of natural environments. So really, what should cities be aiming for? We should aim to capitalise on the opportunities that blue spaces present, minimising the risks and maximising those co-benefits to health. We need to use an evidence-based approach to evaluate our interventions and to lead our design and landscape plan and urban planning. For that, we need robust tools, which I'll be talking about in a moment. And we need to involve stakeholders, so extensive consultation with a wide range of stakeholders, co-design with those most affected by various kinds of intervention, and even citizen science in terms of applying these tools. The Blue Health Toolbox was a big output of the project, and it comprises 6 tools which operate at different scales, all to be used for evaluating the potential impacts of interventions in blue spaces. It can be used for all kinds of intervention, everything from small-scale changes in the urban fabric to large-scale changes in law or educational activities aimed at encouraging people to use blue spaces, for example. And these are freely available, and you can find a document on our website which provides guidance on these. This diagram demonstrates the scales at which the different tools can be used, so right from the site level all the way up to the national level, or country level, international level, and these 6 tools I'll just give you a short overview of. So the first of these is a decision support tool which provides risk and benefit guidance to urban planners. It highlights the magnitudes of health risks and identifies populations that might be affected. It provides guidance on how we can enhance health in blue spaces through certain kinds of physical and social activities, and it informs risk assessments and long-term decision-making processes to help us manage our urban blue spaces, and identifies the ecosystems that need protecting. Moving also, at the site level, in order to understand the characteristics of a site, we developed the Blue Health Environmental Assessment tool. This helps planners evaluate the social, physical and ecological characteristics of a blue space, and targeted versions of this could be used by both either professionals or community members, like I said before, a kind of citizen science approach. My colleague Himanshu Mishra will be talking about this in just a moment. A behavioural assessment tool works at the site level to understand how people use a site, what are they doing, who is doing it, and where are they doing these things. And it allows researchers to make comparisons between different groups of people and different kinds of activities across a whole site. This has been built in the open source software QGIS and allows people to compile this information in a way that they can then use it in their decision making. Just for an example, we conducted an urban beach regeneration, and Himansu led this work and redeveloped a space that was used for informal parking and not really accessed very much, but right next to a historic area of docks. And this was the before heat maps, so the darker areas show where people were typically moving. They were avoiding the site itself. This is the road which you can see here. In the middle of this diagram, this road is the one which you can see. And afterwards, when this was actually developed into a kind of communal space overlooking the sea, it's clear that people were then gravitating towards this space and exploring other areas of the site that previously they hadn't used. A community level survey was developed to work out who is affected by an intervention and how they're affected in terms of their social context, their well-being. And this really builds the evidence base to support interventions and to support whether or not they were effective. And this can be kind of adapted to suit the specific situation that's being assessed. Soft GIS, which allows collection of qualitative data on a spatial platform, can be used at the city and regional levels. It's not a bespoke tool to this project. It was developed in Finland by a researcher, Marketta Kutte, and this allows soft observational data to be attached to hard objective GIS data. And I'll just give you an example where people were asked to specify their favourite blue spaces in Plymouth again, and this could be then represented as a heat map. It gives you an idea of where perhaps the blue spaces are not being visited. It gives you an idea where maybe the ecosystem could be challenged by the degree of visitors, the magnitude of visitors in a particular location, just as examples. And at the very top of the tree in terms of spatial level, we've got the Blue Health International Survey, where we surveyed 17,000 people across 18 countries. Using validated questionnaire items, and this survey gives us ideas about the kinds of activities and visits that people make to blue spaces, the effects that this has on their mental and physical health, and the differences that you have between countries and cultures. So I'd like to just draw your attention again to this toolbox. Feel free to download this document. It's an accessible document. I hope that you find it useful and interesting. It's available on our website, and it provides links to a lot of other resources, video run-throughs of some of the tools and so on. So in conclusion, we want to exploit the potential co-benefits to health of blue spaces, consider these possible health promoting values of blue spaces when we make decisions about projects and plans related to blue infrastructure, and to evaluate and monitor behaviours, environmental quality and opinions using the kinds of tools that I've mentioned, and to really focus on benefits to health as well as risks. I'd like to end thanking you very much for your attention, and to thank the organisers for this opportunity to present our work, and for all my colleagues on Blue Health. Thank you very much.